What happens during a partial gastrectomy for stomach cancer? When facing stomach cancer, a common surgical option is a partial gastrectomy, which involves removing the part of the stomach affected by the tumor. This procedure aims to eliminate the cancer while preserving as much normal stomach function as possible. The surgery usually starts with an incision in the abdomen to access the stomach. The surgeon carefully examines the stomach wall to locate the tumor and plan the best way to remove it with clear margins. Once the tumor is identified, the surgeon opens the stomach to see it directly. They determine how much tissue to remove, typically ensuring at least a 1 centimeter margin around the tumor to make sure all cancer cells are excised. The affected part of the stomach, often the lower section known as the distal stomach, is then carefully cut away. Nearby lymph nodes are also removed during this process. This step, called lymphadenectomy, helps check if the cancer has spread and guides further treatment decisions. After removing the cancerous tissue and lymph nodes, the surgeon reconnects the remaining part of the stomach to the small intestine. This reattachment restores the normal pathway for food to travel from the stomach into the intestines. The connection might be made directly to the duodenum or to the jejunum, depending on the extent of the removal and the surgeon's approach. Throughout the operation, the surgeon manages bleeding, preserves important blood vessels, and avoids injury to surrounding organs. Post-surgery, patients usually stay without oral intake for a short period to allow the surgical connection to heal. Doctors monitor recovery with imaging tests, such as a swallow study using a special contrast called gastrographin. Pain is managed with medications, and as healing progresses, patients gradually start eating and drinking again. Drains and tubes are removed once the risk of complications decreases, and steps are taken to prevent issues like blood clots. In cases of early-stage stomach cancer, a partial gastrectomy offers a good balance by removing the cancer effectively while maintaining much of the stomach's function. This often results in a better quality of life compared to removing the entire stomach. The specific surgical plan depends on the size and location of the tumor, the patient's overall health, and whether the cancer has spread beyond the stomach. These factors are carefully evaluated during diagnosis and staging to determine the best approach. Overall, a partial gastrectomy is a detailed and carefully planned surgery that involves removing the tumor with safe margins, performing lymph node dissection, and reconnecting the digestive tract. This approach aims to control the cancer effectively while helping the patient preserve as much normal stomach function as possible. Always remember, each case is unique, and discussing options with a healthcare team ensures the best personalized treatment plan.